Hi, I'm Kendall Cunningham, and for my senior project presentation, I'm going to outline the nursing profession, including what does a nurse do, what are the working conditions, where do nurses work, what are the education requirements, what is the job outlook, and what do nurses earn. Registered nurses focus on overall care of patients, working to promote good health and prevent illnesses, educate patients and the public about various medical conditions, treat patients to help in their rehabilitation, and provide advice and emotional support to patients' families. They administer medications under the supervision of doctors and keep records of symptoms and progress. They may also supervise licensed nurses, nursing aides, and orderlies. RNs may spend considerable time walking, bending, stretching, and standing. Patients in hospitals and nursing care facilities require 24-hour care. Consequently, nurses in these institutions may work nights, weekends, and holidays. RNs also may be on call, available to work on short notice. Nurses who work in offices, schools, and other settings that do not provide 24-hour care are more likely to work regular business hours. Nursing has its hazards, especially in hospitals, nursing care facilities, and clinics, where nurses may be in close contact with individuals who have infectious diseases and with toxic, harmful, or potentially hazardous compounds. RNs must observe rigid, standardized guidelines to guard against disease and other dangers. The responsibilities of an RN are defined by the working environment. Here are possible employment options: hospitals, office nurses, nursing care facilities, public health nurses, occupational health nurses, travel nurses, home health nurses, head nurses, or supervisory nurses. There are three major educational paths to registered nursing: an associate's degree in nursing, a bachelor's of science degree in nursing, and a diploma. ADN programs offered by community and junior colleges take about 2 to 3 years to complete. BSN programs offered by colleges and universities take about 4 years to complete. Diploma programs administered in hospitals last about 3 years. In all states, the District of Columbia, and U.S. territories, students must graduate from an approved nursing program and pass the national licensing examination. Overall job opportunities for registered nursing are expected to be excellent, but may vary by employment and geographic setting. Employment of RNs is expected to grow much faster than the average for all occupations through 2016. And because the occupation is very large, many new jobs will result. RNs are projected to generate over 500,000 new jobs, among the largest number of new jobs for any occupation. Additionally, hundreds of thousands of job openings will result from the need to replace experienced nurses who leave this occupation. According to the Bureau of Labor Statistics, median annual earnings of registered nurses were $62,450 in 2008. The middle 50% earn between $51,640 and $76,570. The lowest 10% earn less than $43,410. The highest 10% earn more than $92,240. The two things every nurse must be able to do is take blood pressure and draw blood. At the end of my presentation, I will demonstrate both. Why do I want to become a nurse? I have a strong desire to help others. I want to have flexible working hours, and I would love the opportunity to travel the world. Now I'll demonstrate my blood draw and blood pressure. Thank you for your time.
I'm now going to demonstrate the proper way to do a blood draw. When doing any type of medication administration, you need to know the 5 rights. Right drug, right dose, right time, right route, right patient. So if you can tell me your name and your date of birth.
Riley Cunningham, August 8, 2000.
Okay. Once that has been identified, you're going to take your tourniquet and apply it on the upper arm. By doing this, the purpose is to keep the arterial flow, which is the blood going down the arm, and stop the venous flow, which is the blood going back up towards the heart. Okay, once that's on, you want to identify the vein and clean it with alcohol. Can you make a fist for me? Okay, once that's done, you're going to take your butterfly needle and you want to do it bevel up. You should see a flash of blood. Once that's done, you're going to take the vacutainer and push it into the tube. Okay, maybe this one. There we go. And then it will fill. So that is the proper way to take a blood draw. So then once that's done, you're going to take gauze, or you're going to remove the tourniquet, and you're going to take gauze and have it ready, and then put it on. Okay, and thank you for your time. I'm now going to demonstrate how to do a proper blood pressure. You need to pump it up to the top number. Once it's at its top systolic number, you're going to release it and listen for the first heartbeat and the last heartbeat. Okay, his first heartbeat was at 120, which is his systolic number, and his last heartbeat was at 80, which is his diastolic number. That's what his blood pressure is.